もっと科学的に見える診断マニュアルを作ったけど、これまで以上に科学的じゃないみたいだね。
DSM3 に含まれる精神障害の数は259に急増したの。でも精神科医は本物の医学であったという考えを売り込むために、彼らは科学的に聞こえる印象的な理論を作らなければならなかったのよ。
But with DSM-3 from 1980 on, there was the progressive medicalisation of psychiatry, and the notion of chemical imbalance was invented and essentially took hold.
本当に科学的なんだって？
化学物質の不均衡理論よ。これは脳のある特定の化学物質の不均衡によってどのようにうつが引き起こされうるかを説明するために1965年に最初に提案されたの。
それで
ジョセフ・シルドクラウトが精神薬はこういった化学物質を変化させることから、精神病はその化学物質が過剰に多いか少ないことが原因に違いないとして理論づけたの。
あべこべじゃない？
確かにアスピリンは頭痛を抑えるから、頭痛はアスピリンの欠乏が原因と言っているようなものね。
なるほど。
でもこれは精神医学と DSM3 に科学的なオーラを漂わせるには十分だったのよ。ロバート・スピッツァー曰く、
Psychiatry felt now, gee, we're more scientific, we're part of medicine.
効果があったんだ。
そう。それ以降、精神科医と製薬産業はこの化学物質の不均衡理論を医学や国民に容赦なく売り込んできたの。
If you're one of the millions of people who live with uncontrollable worry, anxiety, and several of these symptoms for 6 months or more, you could be suffering from generalized anxiety disorder, and a chemical imbalance could be to blame.
Pristiq is thought to work by affecting the levels of two chemicals in the brain.
It works to correct chemical imbalances in the brain, which may be related to symptoms of social anxiety disorder.
Cymbalta works on serotonin and norepinephrine.
Hundreds of thousands of patients have been prescribed Abilify. Ask your doctor.
Ask your doctor.
Talk to your doctor. Call your doctor.
Ask your doctor about Cymbalta.
Pristiq is a key in helping to treat my depression. Ask your doctor about Pristiq.
You come to my office and I say to you, well, you describe what's going on in your life and your symptoms, and I say, well, it's clear to me that you've got a chemical imbalance and we're going to write you a prescription for this. The truth of the matter is there's no such thing as a chemical imbalance.
There's no test out there that they can depend on that tells you you have a chemical imbalance.
There's actually, in fact, dozens of studies showing that there isn't any measurable imbalance. So psychiatrists will explain to patients all the time, this is just like diabetes. In diabetes, you have low insulin, we have to readjust the insulin level. In depression, you have low serotonin, we have to readjust the serotonin level. But actually, we have already proven that there's nothing wrong with serotonin levels. It's completely a myth, disproven by our own evidence.
I had a psychiatrist. He said that, in his professional opinion, this child had ADHD, a chemical imbalance of the brain. And when he was questioned on the witness stand as an expert witness for the state, he was asked if they had done an MRI. He said no. He was questioned if they had done a CAT scan. He said no. He was asked if they had done any bodily fluid check known to medical science to prove that this child had a chemical imbalance of the brain. He says no. And when he was asked how he arrived at this ADHD diagnosis, a chemical imbalance of the brain, it came down to that he had counseled and observed this child for 2 hours, and half of the time was observing. How do you arrive at a diagnosis of a chemical imbalance of the brain by talking to a child and observing them for 2 hours? You don't. Okay? It's pure guesswork.
うわ、本当の話？
自分で確かめてみて。何人かの精神科医に精神病に対するテストに関して尋ねた模様を隠しカメラで捉えたの。
Of any scientific test?
Not that I'm prepared to do this time.
So you getting that I have adjustment? What is
it? Adjustment disorder, mixed emotion features. It just means situational stress.
Right,
it's a formal diagnosis.
But I'm saying, just where do you get that from?
I take you at face value.
In terms of diagnosis, there's no way that I can X-ray or so it's very hard to have any kind of measure, because whatever's going wrong, it's happening in there, and we just can't go in and open up, somebody's skull and scoop something out to measure.
Right now, we don't have an X-ray or blood test. That doesn't mean that the diagnosis is not correct. The diagnosis is for insurance, and I'm not really kind of thinking in terms of diagnosis. I don't really see that as my main job here to make a diagnosis, except give something to the insurance that's reasonably accurate.
But we don't even really know what's going wrong in the book. So all the things that we found were found by accident.
びっくりだね。精神医学的診断は完全に個人の見解に基づいてたんだ。
彼らがやることなすことすべて間違ってるの。イギリスの BBC テレビではこんな番組もあったの。5人が普通で残り5人が精神病と診断されたことがある10人のボランティアがいて、3人の有名な精神保健の専門家が彼らを観察し、彼らの状態を決めるというものよ。
なんてこった。
見てみて。
We think that it's likely that you've had a history of bipolar disorder. Is that correct?
You're wrong.
Okay.
We've come to the conclusion that at some time you've been diagnosed with a mood disorder.
You're wrong.
We were wondering whether at some point in your life maybe that you had suffered from a significant psychiatric problem of some kind or other.
No.
Not at all.
You are wrong.
All right, okay.
3 wrong diagnoses in a row. After a whole week of observation, the panel have identified just 2 out of 5 disorders.
なんて科学的なんだろう。
まったくその通りね。
Okay, I'm in. And I got a pair of compulsive disorders here.
精神科医は証拠を持っていないのに、どうやって彼らは証拠に基づくなんて言えるんだい？
そんなもんじゃないわ。精神科医には精神障害の裏付けとなる試験結果がないだけでなく、精神障害とは何か定義さえできないの。
嘘だろ？
DSM でも言ってるわ。見て。
Although this manual provides a classification of mental disorders, it must be admitted that no definition adequately specifies precise boundaries for the concept of mental disorder. There you go.
信じられない。
でも精神科医はやめなかったわ。DSM-3 から14年後、DSM-4 を出版したの。そしてその編集長はさらに精神障害という用語を曖昧にしたのよ。
There is no definition of a mental disorder. It's bullshit. I mean, you just can't define it.
自分のマニュアルのタイトルに使った精神障害って用語を定義できないのを認めたのに、さらに障害を付け足したの？
115が足されて全部で374になったのよ。
DSM-1 の時の3倍じゃん。
しかもたったの40年くらいで。しかもこの本はおよそ 2kg 以上もあるの。
単ページ以上じゃん。
精神病の購入用カタログね。これで世界中の1億2000万人が精神病と診断されたの。
すごいね。でも国際疾病分類はどうなの？それにも精神障害が付け足されたの？
もちろんよ。この ICD の精神行動障害のセクションはほとんど DSM と並行しているの。DSM と同じように変化しているというわけね。
なるほど。今のところ分かったのは、精神障害の診断を確証する試験結果はなく、化学物質の不均衡理論を証明できず、彼らは精神障害が何なのかさえ知らないってことだ。
しかも彼らは少なくとも仲間内でそれを認め合っている。最近の米国精神医学会の会議である著名な精神科医がこう述べてるわ。
You're sitting in your office, you see a depressed patient, you have no idea what's the matter with them. And I know all of you think you know the answer, but in terms of evidence, I don't know the answer, and I don't think any of us really know.
驚きだね。
でも彼らは診断をかなり素早く決めるのよ。これは同じ会議でのもう一人の有名な精神科医よ。
Jim Burley at the Maudsley Hospital did a study once on how long it took people to make up their mind about the diagnosis after they entered a room, and it was about how many, David? It was 2 seconds. It was a couple of minutes. It was very.
2分？
ええ。当時の米国精神医学会の会長までも DSM はかなり冗談だと記録に残しているわ。
Well, what does D stand for? I used to think it is diagnostic, but over the last few years, realized it is more like a dartboard.
ダーツの標的？こんなことを精神科医は患者に言ってるの？
いいえ、精神科医は一般の人には全くわからないようにしておいて、自分たちはそれに通じているふりをしているの。
I was sent to a psychiatrist who saw me again for maybe about 15 minutes, talked to me how I was doing at 7 years old, and I left with a prescription for Ritalin.
Probably within the first 15 minutes, he diagnosed me with having an anxiety disorder and put me on prescription medication.
The amount of time it took for the diagnosis was, I'd say, probably within 10 minutes I was diagnosed with anxiety, with depression, within 10 minutes of speaking to the psychiatrist, and I was put on those drugs immediately.
I received numerous different diagnoses from different doctors, and each one gave me a different drug.
I didn't have to undergo any tests. I didn't even have to sit there and I didn't have to ask any questions. It was just that's what you've got, and this is the drug.
They really didn't talk to me. They were always talking and questioning my mother. It was all about getting the information from her and not from me.
It doesn't make sense to me. I researched it, I've done my research, and I still can't fully understand how you can diagnose somebody with a short attention span.
There was never an explanation. Nobody really knew what it was or why it was caused or how did you get it, why did anybody have it, and what could anybody do about it. Just here, have some medicine and go away.
And I was put on, a horse's dose of an antidepressant called Effexor, 450 milligrams a day. They say if you're on 300, you're comatose.
It wasn't always Ritalin. It went from Ritalin to Wellbutrin to Concerta to Adderall.
I remember asking these doctors, is there any other way we can do this? Is there any other therapy? Is there something we can do that won't make me feel so badly, that won't give me all these side effects and just horrible sensations through my body 24 hours a day? Is there something else I can do that might be not having to do with medications? Doctor said, no. See, what you have is very complex. You have a chemical imbalance in your brain that the only thing that can correct it is medication.
うわ、たくさんの診断があるけど、結局は薬に行き着くみたいだね。
そうね、現在精神科医の診断イコール精神薬となっているの。
The whole question then becomes, okay, if we apply these labels, what next? And the what next tends to be you get a prescription. And the prescription is for a drug that doesn't work very well and is toxic.
It's like a 1-2 punch. The number one of the 1-2 punch is the diagnostic manual. You've got all these disorders to choose from. The two is the treatment. So you've got the diagnostic manual in place, you've got a machinery in place, and then you've got this treatment that is there for the taking.
For everything you can think of that might seem to be odd behavior, the psychiatry field has a name for it.